everybody. Welcome to On the Screws Golf. We'd like to thank you for being here on the stream. So what? And welcome to DCF&P, baby. And again, thank you so much for attending, and please consider subscribing. All right, welcome everybody. Good to be back here this evening, and we're going to do a little PSA, public service announcement, for something that I have been going through in my personal life, and that is called, up on the screen here, DUPUYTREN's contracture. So you're all saying, what the hell's DUPUYTREN's contracture? Well, I'm going to share a little bit about that with you this evening, and hopefully you'll get a little of information, yet at the same time look at some gnarly pictures in my hand, and you might find it a little bit interesting. All right, so let's start with taking a look at my hand. Okay, so I had surgery 2 weeks ago on Wednesday, so 2 weeks tomorrow. And you'll see that my hand is in a $27 isotoner glove, okay? And in the palm is gauze and padding. This is a molded brace for the evening, so when I sleep at night, what happens is you usually curl up and your fingers curl, right? That's normal for every human being. But after DUPUYTREN's contracture, you'll understand that this disease makes your fingers curl in automatically. So if you don't keep the two surgically repaired fingers, which is my pinky and my ring finger on my right hand, they will curl at night, and we may have to go back in and release the tendons, additional surgical procedures. We don't want that. So that's where we stand right now today. And today is December 13th, 2022. It's 10:43 Eastern Standard Time, p.m. So what I'm going to do is I'm going to do a daily little video. Okay, so tonight is just an introduction to what DUPUYTREN's contracture is, show you that my hand is in an isotoner recovery glove and a little splint for going to bed this evening. And, tomorrow will be the actual first video where we remove the glove, remove the splint, and we will go ahead and actually clean the wound, the surgical site, in front of the camera. Let you take a look at the actual incisions and how gnarly my hand actually looks currently, and give you the advantage of taking the journey with me. But for tonight, just an introduction to what DUPUYTREN's contracture is. Take a look at some pictures, and we'll read through a little article here together. So with that being said, let's go ahead and take a look and see if I can't pull my screen up, and there it is. So DUPUYTREN's contracture. All right, so DUPUYTREN's contracture, also known as DUPUYTREN's disease, morbus Dupuytren, Viking disease, palmar fibromatosis, and Celtic hand. So there's a lot of different terminology for this disease that we have right now. So this is a condition in which one or more fingers become progressively bent in a flexed position. So in my case, and in most cases with DUPUYTREN's contracture, it's the two fingers furthest from your thumb, depending on which hand you have it in. Now, be honest with you, I have it in both hands. So you can see the fibroids right here. You can see my tendons starting to protrude through my palm because they're starting to have all those fibrous tissues starting to aggregate around that. Sooner or later, you can see how my fingers are starting to pull in like that. That will occur, and I'll have to get this hand done at some point. But that's going to be probably a year, year and a half, 2-year process before we get to a position something like that, okay? And then we'll go in and get surgery. But for now, this hand was actually just these two fingers, the pinky and the ring finger, were curled in significantly. I couldn't shake hands. I was able to hold a golf golf club and play some great golf, because with that curved finger, right, you grip the club anyway. So I had no issues. Now, trying to do an interlocked grip like I do with golf, that was a little bit painful on certain situations, especially when you're wearing a glove on one hand. It became more and more uncomfortable. But we got through that, played some great golf this year. And the reason we did this late this year, recovery time is about 3, 4, 5 months. Let's get this out of the way in late November, all of December, January, February, March, recovery in Ohio. And then starting in April, when the weather starts to break, we'll be out there fully flexible, hand recovered. We'll be playing some golf. Okay, so back to the article. So it's named after Guillaume DUPUYTREN, who first described the underlying mechanism of action, followed by the first successful operation in 1831 and publication of the results in The Lancet in 1834. So it usually begins as a small hard nodule. You can see those things right here, that big nodule right in my hand right there. See that right there? You can see that. Pretty significant. Just under the skin of the palm, then worsens over time until the fingers can no longer be fully straightened. While typically not painful, and it's not, some aching or itching may be present, and you can feel it. And when you feel that aching and that itching, it's, to be honest with you, that's when the tightening of the fibrous tissues are beginning to grow and expand and cause contraction of your tendons. It's really interesting feeling. You can actually feel it. It's like actually a growth in your hand, causing those fingers to curl. The ring finger followed by the little or middle fingers are most commonly affected. It can affect one or both hands. The condition can interfere with activities such as preparing food, writing, putting the hand in a tight pocket, putting on gloves, and shaking hands. So some of the real issues I had was, number one, shaking hands. Number two was trying to do any type of exercise with a push-up. I couldn't do it. So I had to, make a fist and do fist push-ups. Not very comfortable. And then playing basketball. Could not play basketball. With 2 fingers curled, could you try to catch a basketball and then shoot with 3 fingers? It's very difficult. You have to kind of just push it. You can't flick it. You can't put any spin on it. It's just like a knuckleball going up there with no touch, and it's pretty bad. So if you ever want to beat me in a game of horse or one-on-one, now is the time. The cause is unknown, but might have a genetic component. Risk factors such as family history, alcoholism, smoking, thyroid problems, liver disease, diabetes, previously hand trauma, and epilepsy. Now, fortunately, in my history, I have none of this. I don't even know if I have family history of this, but maybe somewhere in my lineage. But no alcoholism, no smoking, no thyroid problems, no liver disease, no diabetes, no epilepsy in my family. So it's just one of those things. I have a Northern European heritage. We come from Europe, my heritage, and we're German. Obviously, we might have a little bit of Viking in our lineage as well. So I got that going for me, I guess, right? Underlying mechanisms involves the formation of abnormal connective tissues within the palmar fascia. Diagnosis is usually based on a physical exam. Blood tests and imaging studies are not usually necessary. Now, I first noticed this when I was lifting 2.5 years ago at the Y, and I was doing curls, and I'm like, why am I getting all of these calluses on my hand? Why are they so hard? And it was DUPUYTREN's, the start of DUPUYTREN's. Had no idea what it was. Went to my primary care. He's like, oh, that's DUPUYTREN's. We're not going to do anything until you get your fingers to this point. Once you get to that point, we'll go in there and send you over Dr. Schwindeman. He's the best in Youngstown. And by far, right now at this point, he really actually is. Based off of the surgical procedure, the recovery, the constant communication, he's just a wonderful doctor at this point. So you could see it's not the funnest. Now, I did have hydrocodone, which is an opioid. I stayed on that for 2.5 days, but just don't like that feeling. The side effects that go with that: dizziness, blurriness, feeling spaced out. You have constipation, eliminates the need to pee, so you become bloated. So a lot of different side effects that you don't really want to participate in if you don't have to. Plus, opioids, if you have an addictive personality, if you type A, this, that, and the other, if you're in constant pain in other parts of your body, that can be a real nice relief. But it could also be very addicting, as you well know, I'm sure, out there. So we stay away from as many of those as possible. So I think I had 30. I think I have 26 and a half left. So it is what it is. What else can I tell you? Let's move on to the next paragraph here. Initial treatment is typically a cortisone shot into the affected area. I did not get any of that. Occupational therapy, I didn't get any of that. Physical therapy, did not get any of that because I just let it go. Among those who worsen, clostridial collagenase injections, which I did not get any of those. And then I did elect for the surgery. While radiation therapy is used to treat this condition, the evidence in the use is scarce. Royal College of Radiologists, Faculty of Clinical Oncology conclude that radiotherapy is effective in early-stage disease, which has progressed within the last 6 to 12 months. The condition may reoccur despite treatment, and that's what's going to happen here probably. It does return after treatment. If it does return after treatment, it can be treated again with further improvement. It is easier to treat when the amount of finger bending is more mild. So in this hand, we're going to go a little bit earlier than we did this last time. Last paragraph here. It was once believed that DUPUYTREN is most often occurred in white males over the age of 50 and is rare among Asians and Africans. It sometimes was erroneously called Viking disease, since it was often recorded among those of Nordic descent. In Norway, about 30% of the men over 60 years old have the condition, while in the United States, about 5% of people are affected at some point in time. In the United Kingdom, about 20% of the people over 65 have some form of disease. So I am in one of those 5% in the United States that have the ailment, whereas you're looking at 30% in Norway and 20-some% over in the UK. So let's go ahead and take a look at some pictures now. So this right here, I don't know if I can just click on it. Will it come open? And there it is. Okay, so you can see that, what we talked about. I don't know if you're not going to see that. But you can see in that ring finger on this gentleman's, I believe that's his right hand, laying with his hand down. You can see that nodule and the tendon, and it's starting to pull in somewhat, still fully flexed and straight. Mine, unfortunately, didn't work that way. My whole finger started to bend at all knuckles, so it was pretty interesting at best. So you can see here in more of a graphic, you can see that is what happened to my hand. Those two fingers were on my right hand, and the ring finger and the pinky pull in. You can see the tendons be pronounced. You can see the fibrous tissues just wrapping around that and pulling it through. Now, there is an injection that can be injected into a DUPUYTREN's contracture hand, but it has to be a more mild form of the disease, and it can't be a spiral format. Mine is a spiral format, which wraps around the tendons. If it's not a spiral format and it's just more of the pads within your hand, they can inject a new product into your hand, which will dissolve those fibrous tissues, and you won't have to do any type of surgery. But unfortunately, I did not, in my right hand at least, did not have the opportunity to get injections versus actual surgical procedure. Hand deformity that occurs with knots of tissue form under the skin eventually pulls one or more fingers into a bent position, mainly affects 2 fingers farthest from the thumb, most often treated with enzyme injections or surgery. Let's take a look at that one. Look at that. Yikes. Mine did not look that bad. Okay, now that is more of a gentleman who's aged, but some of these are pretty bad. Look at this one. Boy. Again, it doesn't hurt. It's just inconvenient. It changes your quality of life for sure. So, brutal. All right, so let's take a look at here. Let's take a look at the stages of Dupuytren's. So stage 1, tissue beneath the skin begins to thicken. Sorry, guys and gals. Sorry about that. Forming a small nodule. And then the tissue continues to thicken, pulling fingers closer to the palm. The cord fully forms, bringing fingers even closer. And I'm not getting a good... not able to work the iPad on that one very good because that's it's when I try to open it or close it, resizing it, it flicks down to the bottom of the page. So we'll just take a look at this schematic here. You can see the nodules on the tendons starting to accumulate, causing that contracture or that pulling inward of the fingers. This right here, I don't know if mine looks that bad, but it's very similar. So when I went in today, it was, mine was prettier, but uglier. So let's talk about that. So prettier meaning in his palm, you see how that serpent-like zigzag and how the skin is pulled together but raised. Mine is not raised. Mine is just nice and flat and really pretty. More like this one right here. You see that? That's what mine look like. I can't expel that higher or larger. But that's what mine look like. But mine got a little bit of moisture under the pad during the 2 weeks of healing, just due to seepage of the wound. And my top layer skin was pure white, so they had to cut all of that off. And it's nice and clear and clean underneath, a little raw, but that's pretty much what my my result looked like as of today when they took the bandages off. Now, I will say, let's go back here now, that I'm looking for that one picture I had. Where is it? I apologize for this. Here it is. So that last picture only usually had it in the palm, that zigzag. My fingers, both the ring finger and the pinky, look like this picture, more like this, where the zigzags go all the way up to that second digit. So it's pretty significant, kind of like that. Okay, so today I went in, they took the bandages off, and they clipped out all of my stitches, and that wasn't fun. It was it pinched. It wasn't fun. Let's just put it that way. It didn't hurt, but when your fingers are numb, your hand is completely swollen, and the guy's pinching and pulling all these things out in a raw wound, it's not fun. We'll just do that. I didn't cry or anything like that, but it was uncomfortable. How's that? Uncomfortable. Take a look at that picture. Oops. Oh, I lost it. But you can just see some of the actual surgical. You now understand what Dupuytren's looks like, and it's one of those things that you really don't want to have. So look at this. Here's this gentleman has what I have, right? Look at that. There it is. So he has his on the under part of his hand. Mine is on the outside of the fingers. So there it is. Just looking at the different just the different pictures that are available. So yeah, so you'll see me over the next few days. Look at that. Whew. That's kind of what happened to me today. This top picture, okay? This one right here. Does it work? No. Or maybe even this one. Yeah, that's what mine kind of looked like, right like that. It was a little white, so they peeled all of that that white tissue off, and I have a nice pink and red next skin layer underneath that, and I'm well on my way to healing. So he wasn't too happy at the beginning. He's a perfectionist. He even told me that he didn't like how that looked, how the water got in there, or the fluids from my hand caused that little bit of an infection. But once we got in there and cut away some of that tissue, it was in really good shape. So, all right. So with that being said, tomorrow morning, I'll get on here and we'll peel off the makeshift splint. We'll peel off the glove. We'll pull off the gauze that's in here, and we'll go ahead and take a look at the hand and take a look at the incisions, maybe do a few measurements, and we'll chronicle this every single day from now through physical therapy. We'll talk about that, and to recovery. So we'll be doing this for about maybe 2 or 3 months. But I hope you'll stick with me through the process, and I'll play some finger golf in between, some golf clash, and we'll get through this together. But very painful certain evenings at night, during the recovery process. But most irritating thing and the most unique thing about this is because of all the nerve endings being cut and having to be opened up and pull all that tissue out of there, my two fingers, of course, my pinky and my ring finger, numb, completely numb, right? And it just, to the touch, you can feel it, but it's numb and it tickles and there's pins and needles in it. But at the same time, it's one of those things where I'm glad that it's Dupuytren's contracture and it's not something more severe in my life, right? So we're going to get through this. We're going to take 2, 3, 4 months of recovery. We'll get done with it, and then we'll be back to normal. So that's it for this evening, about a 25-minute video on what Dupuytren's contracture is, what the actual history of Dupuytren's is, the actual pronunciation, and if you ever hear of anybody, you now know what they're going to have to go through over a period of time, what the actual opportunity for treatment is, whether it's surgery or injections, or they're just going to wait until they get a contracture that is significant with their 2 fingers, and then they'll move forward from there. But it's an individual decision. A lot of people were afraid of surgery. I was not afraid of surgery. I got there at 6:15 in the morning. I was in at 7:15. I was home by 11, and I was recovering. So about a 3-hour process to get all that taken care of. And like I said, had a very wonderful surgeon, great bedside manner, and a perfectionist. So Look forward to having full functionality of the hand. And I have a great physical therapist. Her name is Sandy, and I'm going to go see her on Friday morning at 7 a.m. just to make sure we're changing the dressings correctly and everything's progressing forward. So, again, thank you for stopping by and joining the stream and taking a, I guess it's not memory lane, but taking a walk with me down DUPUYTREN's contracture and actually what that disease is and how it affects the quality of life of individuals around the globe. And I'm just one of many. So until next time, which is tomorrow morning, have a great evening and hit them straight if you're playing golf, Clash. If you're playing real golf, I'm envious, but I'll be back with you soon. All right, have a great night, everybody. All right, everybody, welcome to On the Screws Golf. We'd like to thank you for being here on the stream. So what? And welcome to DCF&P, baby. And again, thank you so much for attending, and please consider subscribing.